All right. So what this is that it actually is a ruptured abdominal aortic aneurysm. The significance of this is that this very well is life-threatening. This is the patient who I am paying the most attention to and keeping a close watch on. So what is an abdominal aortic aneurysm, or what we call a AAA? So there's different types. You can have a fusiform, where it's like you have ballooning of the entire aorta, saccular, where it's just on one side, or you can have mycotic, which actually is due to an infection of the actual wall itself. Super rare, but I actually had one of these as a resident. Now I think we need to go back and talk about what exactly is an aorta. So your aorta, everyone has it. You have your heart pumps blood through your aorta, and that pumps blood to everywhere else in your body. So your aorta is a very, very important vessel. It is the biggest one in the body. Now, if you have an aneurysm, that means that part of the wall is weakened, and so it has now kind of ballooned out or gotten a little bigger. You can have aneurysms and they be fine, but the problem is depending on the size. If it's less than 4 centimeters, probably has a low risk of it rupturing. If it's greater than 5 centimeters, it's a higher risk of it being ruptured, and typically those would be fixed with a vascular surgeon. Now in this patient, if you look at this image, this aorta is huge. It's almost 9 centimeters. And so there's a very high risk of this rupturing. Without a surgery, have a high likelihood of dying. With surgery, you also have a high likelihood of dying. Carry a very high mortality. And many times if they rupture, patients may not even make it to the hospital with a pulse. The mortality when it ruptures gets near 90%. You take these extremely seriously. Now, risk factors for it. Typically males, those who have uncontrolled hypertension, a tobacco user. So ways that patient can present this classic triad, and a pulsatile mass on exam. Palpate their belly as if you're feeling the heart beating in their belly. Things that you want to order, you want to make sure that you check their blood levels, because you can lose a lot of blood with these. You're keeping an eye on their vital signs, their coags, stop any blood thinners, and actually try and keep these patients a little bit away from fluids, where it's okay that you keep their blood pressure a little low. That's completely fine. So an ultrasound typically is like 99% sensitive for these. A CT scan is pretty much 100% sensitive. If you are talking to vascular surgery, you want to cross a bunch of units of blood, immediately trying to get this patient to an operating room to fix this. So I say that I believe that God saved my patient's life, because if you listened to this video and you listened to the prior video, you understand how life-threatening these can be. In this case, the bleeding kind of clotted off and stopped. They were able to get to an operating room, have surgical fixation, and still be alive after the procedure. And I am incredibly thankful and very happy for this patient. I hope that they continue to do well. I feel like it is nothing that I did. This was just God's hands placed on this patient. It just was a vessel through him. I just really wanted to share that story. Yeah.